call me Cuba Pete. I'm the king of the rumba beat. When I play the maracas, I go chick, chicky, boom, chick, chicky, boom. Hey!
Well, welcome back from summer break. Hi, I'm Joe Greer, Pedro Jose Greer. I'm the dean at the College of Medicine at Roseman University here in Las Vegas. Today we have a very special show, and it's going to be more of a conversation on the intersection between how things in society work and how we can help the most vulnerable and educate the future generation of healthcare providers. I am honored to have here today from Orange County, just flew in, Daisy Chen. She is a partner at AlphaConverge, a management consulting firm that is recognized as one of the best in big data, data integration, business intelligence, and machine learning. Apart from being brilliant, she's also she's breaking barriers. Very few women are in the position that she's in, and even more so, very few women of underrepresented minorities. She has worked in the data field, she has worked in the technology field, and she works in everything from marketing to helping companies and consult. She's the founder of the best big data and the most innovative machine learning company in Nevada. She has almost 2 decades of experience. You can't tell. You would think she's 18 years old. In tracking complex projects for highly matrixed Fortune 500 companies, a leading management consulting firm, and top media and advertising agencies. And she's here to talk to us today about her expertise in technology, in the future, and how that applies not just to those of us that can afford this, but how does this apply to those that can't? How do we use this technology? How do we use this marketing? How do we use all these different things to really improve the lives of people here in the Valley and then hopefully around the country? Next to her is, I will consider her an old friend, or a young friend. I'm the old part. This is Dr. Fairclough, Jamie. She serves as our Associate Dean for Assessment and Evaluation at Roseman University College of Medicine. She brings with her a wealth of knowledge and expertise in professional program accreditation, measurement, evaluation, and expertise in professional program accreditation, measurement, evaluation, and assessment analytics, as well as a decade of experience conducting mixed methods research across communities, clinical, and educational settings. She works collaboratively with pretty much everybody, and which is one of the important things we need to do in society. We got to get rid of these silos. If not, we're not going to come to real solutions. By the way, she got her bachelor's of science, health science education, a Master of Public Health degree, and a Master of Science in Pharmacy from the University of Florida, my alma mater too. And her husband today was nice enough to dress in orange and blue. But she also has a PhD in Human Sciences from Florida State University and subsequently completed her postdoctoral fellowship training in behavioral medicine research at Duke University Medical Center. Jamie has achieved heights academically, intellectually, that people can only dream of doing. Oh, by the way, she's a member of Mensa. That means that when she leaves the room, the IQ, well, if I leave the room, the IQ goes up. But if you leave, it drops. And a repeat visitor that we have here, Dr. Karin Esposito. She's our professor and our senior executive dean for academic and student affairs at Roseman University College of Medicine. Karin I have worked with and I have known for almost 20 years, where she did a spectacular job at FIU. You have met her before here on the show. And the interaction here is to talk about technology, education, and students, and what we need to do that. Because the other thing too is we're also going for first generation students, gen college, which means they might not be as versed in technology as their peers that are coming in. So, Daisy, now that I described who you are, tell me what you do.
It's an honor. I'm very humbled to be here, part of the discussion. So I'm like analytics data science person. So I try to use AI and data science and technology to help businesses to innovate. And so we AlphaConverge, like we're constantly researching to stay ahead of the game and help our clients to stay above the curve.
Have you ever been involved in medical education?
In education, I would say we helped companies in this sector to train their talents with the AI data science skills.
Fantastic. And have you thought of ways, how can we help the part of America that doesn't have access to Wi-Fi? As our team Genesis, which is our household centered care model, tells me, they're going to households where people don't even have emails. And some people think email is already antiquated. I have an AOL account, okay? I actually still pay them every month. So I feel bad if I quit paying my $4.99, the company might collapse. So what I'd like to do right now is open this up for Karin and for Jamie to start the discussion and ask the questions. Because you are the educators. You are the ones here that are going to form the different minds. She has an expertise that expands beyond just tech. It's business, it's marketing, it's all these different things. How do we convert those secrets into not making money, but making people healthier? So Jamie, what do you think?
Certainly, I think there's a room at the table for everyone here. So, as you mentioned, having physicians, two physicians as yourselves, and myself trained as data scientist.
Yeah, but she also has a PhD in
absolutely. So she's
and she's a classical musician.
Yes,
and she climbed the Alps. She climbed the Alps.
You have to have that part in there. Yes, but Daisy being in technology and a leader in the field. So I like the fact that we're coming together to have these conversations. And just, again, being able to sit with Daisy, we had met previously and just were talking about the opportunities that are there. Daisy having experience with healthcare entities to figure out how to provide, improve patient care, patient outcomes, but then trying to think of how we can then apply that to education. So training our students. So I think I'm very happy to be here and to have someone with our expertise, but then also coupled with yours can be so beneficial. And so.
And it's going to be very different for the doctor of the future. It's very different for the doctor of today.
Absolutely.
For example, with AI, you're going to develop algorithms. We need to train the doctor on how to pick the outliers. Not everybody fits into the algorithm. And we have to be also very careful that medicine does not lose its human touch. Technology is a tool, just like our stethoscope and ophthalmoscopes, all of those. They don't give you the answer. They give you the tools to come up with the answer and how to do that. Mm-hmm. Karin, you had some questions.
Yeah, I mean, I think, again, thank you, Jamie. It's, it is great to have that conversation and to span different fields. And that is something that I think medical schools really need to recognize, because we physicians who were trained decades ago can't provide all of the education that the doctors that are coming up need. We don't have that background and that expertise, and there are some of those things that are not part of traditional or historical medical school curricula. So learning about data science, and there's a good bit in the literature starting to be in the medical education literature about the need to address this, but how is not yet clear, right? I mean, you can give a lecture and give people some information, but that doesn't really give them the tools to apply what they've learned. And doctors are already using a lot of systems to help manage the huge amount of medical information that is now, available. It's not anymore just about knowing everything, because that's almost not possible, but how do you access the knowledge when you need it? How do you access the information when you need it? So, any thoughts about maybe from some of your experience developing training programs, like how do you do that? How do you teach people, what kind of curriculum, like what kind of approach to teach people skills where even maybe the current leaders in their field don't have that knowledge to pass on?
I think it's absolutely very important for the physicians to have knowledge in technology, especially I actually had one of those programs called AI in healthcare at Stanford. So they accept not only physicians who haven't had AI background when they were at medical school, and they can go back to school and to learn about those new technologies, and also people who were never a doctor, but they were in technology and they were in AI, and they are serious about to to help like reshape this industry. I think that's absolutely important. And then I think to actually, those AI programs actually are quite technical, and I think it's important for doctors to know those very technical, like how the AI neural network are built, because there's really things that are unique in this industry. Like, for example, if the AI, if the AI model is for other industry and the stakes are not so high, but in healthcare, if this AI model is supposed to diagnose like a cancer, and then maybe even there's a small chance and we want it to be flagged, so bring it to the doctor's attention. And like Google and lots of the companies, they try to put together a team of physicians and engineers, so to create like the next generation of or different kind of AI models. I think there's more career paths for the physicians in the future. Absolutely, the medical school, the textbook are become thicker and thicker, adding more, those new skills. Just like in the past, we don't use computer, but now we all, sort of knows how to use Excel.
Yeah, this is really exciting for me, and there's a lot of talk in the academy about training medical students to be AI literate, not proficient necessarily, because we're not training data scientists, but just really being literate and understanding how to use it. So I'm so excited that we get an opportunity to start talking about this at the table.
And it's just not training them in how to use AI.
Yeah.
It's having them use AI
Absolutely.
while they're in school. Because one thing is you could be trained for something and you lose it. Let me ask you about augmented reality for doing procedures. What a wonderful way to go through a procedure without hurting anybody. Because competency depends upon how many times you actually do that. Doing procedures is more like a sport. The more you practice, the better you are. What do you think of that?
That actually reminded me of very good use cases of AI. So there are doctors that use exploring using AI to simulate surgical procedures. So the simulation can, see like in different circumstances and scenarios what the doctor can do when this happens. So think about if a surgeon who have this tool and versus a surgeon don't have this tool, especially if this procedure is kind of a risky procedure, and then this give this physician a competitive advantage and also improving.
We know for a fact that when a surgical team works together and practices together, that they have much better outcomes. And this was shown at Mass General with thoracic surgery, where the chair was, my generation. So no, I don't need to do that. I've never done that before. The young surgeons that had just gotten on faculty would have one specific team of nurses and assistants, and they would practice, not on humans, but they would practice on simulation, and they had much better outcomes for two reasons. Number one, not just because you repeat doing it, but the human part of working as a team, and so knowing what the other people are doing. Now, we also are very involved in what we believe is one of the responsibilities of medical educators, and that's social accountability. That's to reduce disparities in communities. And we have one program called Genesis, which we've talked about before, which is household-centered care, which now has about 60 households, overwhelmingly underinsured or uninsured. And they work with another program, what we have also called Empowered, which is for opioid-addicted mothers and stimulant-addicted mothers and their children. Now, with addiction, that's a whole separate conversation, but it's all the social determinants that will affect your recovery. So they work closely with Genesis. Now, these are insured because they get Medicaid if you're a mother or a pregnant mother. But here we go into these households, and when I talk to the team, they tell me things like, we go into households where nobody even has an email address. We go into households where nobody knows how to register and get different things. Now SNAP and other benefits for the poor are all online. So if you don't have that access, and some of them don't even live around where there's Wi-Fi. So the kid that goes to the library to study because they have Wi-Fi means they got to schlep the entire family there to teach them how to do it. If we could get Wi-Fi, let's do a perfect scenario. We produce enough providers so that everybody can have a doctor. We bring Wi-Fi into these communities. How is technology going to improve their life?
What I really love about Genesis program is lots of business cases, there are entrepreneurs trying to help low income or rural areas, at the same time can also make a profit to survive. And lots of those use cases involve changing consumers' behaviors. Like I think lots of the people in those areas, they trust people they know. They trust the physicians and people in those communities successfully change consumers' behavior. Like for example, if those wearable devices actually they're relatively less accessible to people this group of population, but they might benefit from them the most because preventative care is always going to be less expensive than emergency care or ER visit. And so if we can, so when we do marketing, and normally we would in healthcare industry or other industry, we believe if the consumer is not ready for say a doctor visit, we're ready to go to the next stage of the customer journey. If we push them information that will not only annoy them, will also sort of it's just not a good practice. So we try to personalize the message and to deliver to the people who really want it, and to move slowly to the next stage of the customer journey, and until they are ready to see a doctor, ready to get treatments. So that's really important in terms of reaching audience.
In some of the populations that we take care of, and particularly the recent immigrants from Latin America, they don't even receive their care here. They'll go back to their home country and buy the medications because it's cheaper and see who they saw there. So you have no record of that going on here. It's a very complex situation that goes on there. And even those with insurance, it becomes we have no system in this country. We have companies, but no system. And healthcare right now is the number one cause of bankruptcy in this country. So we have to look and be careful. One of the reasons for that is lack of transparency. You and I were talking earlier about CVS and Walmart and Kroger's and things of that nature that have those minute clinics. Well, minute clinics are, interestingly, the only transparent system of healthcare in this country. You walk in, there's a menu, and there's a price, and that's it. They don't get surprise billing. You know that if you get in a car accident and your insurance says you need to go to this hospital, many times they'll take you to the nearest hospital, depending on the acuity of the illness. But you go into this hospital that your insurance company tells you to go to. But the trauma surgeon on call doesn't belong to your health insurance plan. You can get a $100,000 bill, apart from paying your insurance. So we have a really broken system. Can technology help that system? Or even just you move from one job to another, you change your insurance. That means you change your doctor, because if the other one isn't on there. So the disadvantage that the vulnerable populations have, particularly the black and the brown, and we saw how they were completely ignored during COVID. They could not participate in telemedicine because they didn't have a doctor. The only ones that participated and had them, that we don't have to deal with insurance because they don't have any. But we can try and get them into it. And we can try and make it so we can bring these families back to resilience. Because remember, 80% of illnesses have a non-biologic cause. The rampant rate of type 2 diabetes in this country is caused because of social determinants. diet, exercise, style of life. Now, if you live in a very high crime area, you're not going for a jog at night, you know, or if it's not well lit, or you have no green spaces. And and so looking at technology as a tool. Now, we use technology in Genesis. We have a platform that follows longitudinally 10 domains of the social determinants of health. Tell me how that can help looking at health outcomes in the future. Can we use that with AI and predictive analytics?
AI, I would say, like if say there's an app, there's some of the app, for example, they try to so by people download. I think that's more like a use cases of augment, like AR. So the people who have neurodegenerative disease, they can download the app, and if they cannot afford, they don't want it to go to the nursing home. So the app actually, that technology actually can show you, this is the way to the bathroom. This is the way. It's the time to get your medicine, and then there will be voices like of your family, like your son too. Seems like he's talking to you, and even actually, his son is actually out there, like in the office working, or taking care of their kids. And so I think we need more physicians who is equipped with technology to come up with more this type of ideas to, because physicians, they are with the patient like every day, and they can just like you have you see a lots of different problems, and if they learn those technologies from school or like a podcast like this, and they can have more ideas.
Well, the way I see it, technology is going to continue to advance. That's not going to stop. So what we need to teach our students are the basics so that they can continue learning for life.
Sure. Exactly, yeah.
And applying these things for life.
Well, with the platforms that we have, like the Genesis platform, being able to collect those additional data points that then we can use to train machine learning models to, better predict certain outcomes, or even like prescriptive analytics. We were kind of talking about that. So going a little bit beyond just predictive. I think that's important. So the fact that we're collecting those social determinants of health data points, we can then feed that into systems. So.
And students.
Absolutely.
Could we use AI in students to be able to predict if they're having problems with their classes?
Absolutely.
Early on.
Absolutely.
Because medical school is not cheap.
Right.
To have somebody repeat a year is extremely expensive. Mm-hmm. And if they don't finish, it's even more expensive with the loans they have. So we have to be able, after we admit them, to be able to support them, to follow them, to be able to identify when they're having trouble, so that we can help them graduate. We go through a very extensive selection process in medicine, as opposed to around the world, where they have a very easy admissions process. They might admit 1,500 into a class and graduate 200. We admit 120 and graduate 110. Is that about right?
Yeah, or more.
No more, or more.
Yeah, more than that. Mm-hmm.
Karin, as the Senior Executive Dean for Student and Academic Affairs, how do you see this being used in student affairs with what we're doing?
I think, there are so many different uses on the educational side, on the student support side. One of the ways in which technology, including AI and other support systems, have, I think, already influenced medical education is in providing a lot of learning support tools. Mm-hmm. So the one thing that we have to watch about that, and I think it's very important that schools think about these tools ahead of time. It's not just what we teach. Our students tell us, I'm using this program to learn this. Mm-hmm. I'm using this app. I'm using this, mm-hmm. support technology. But the problem is that some of those tools are great. So I think it behooves us to take a close look at those, sure. See which ones we think are going to really help support our curriculum and our learning, and then actually provide them to the students. Right. Because if only some students can afford them and not others, then that creates an imbalance and a barrier, again, for the students who are, wealthy and maybe have extra resources or able to buy a lot of these learning support tools versus us really saying, the students are going to use these tools, right? So, and they're going to figure out a way to pay for them or to get them. So how do we help curate which are the best tools to support our curriculum, and then actually provide them for the students, acknowledging that, that whether it's tools that, run exam questions constantly so they can practice taking exam questions in standardized exams, or that present whether it's pathology data or anatomy data, images or things like that in a really learning, user-friendly kind of way. There's some great tools out there, and I think, traditionally, maybe in medical education, it's been like, well, they should just learn, what we're teaching them in the classroom.
They should just
but
learn
the fact is
the
the
way we
students
were
are
taught.
using it. Right. The fact is the students are going to use it, and I think there's so much out there now that if we can help curate that for them and say, our students seem to find that this works, or we think this is a great tool to support our curriculum, that would make some things easier for them.
Okay, one last question to all of you before we end the show, because this half hour has gone incredibly quickly. How are we going to save the world? And how are we going to use technology and medical education to do that?
For me, I definitely think it's kind of what I started with, just us coming together. As a data scientist, one of the first things we're trained in is the importance of the domain knowledge. So we're not physicians, we just aren't, and we're not, necessarily public health professionals or whatever have you. So we have to understand what you all know, and then to better the technology based on that. So I think that that's one way that we can do it. If we all come together, sit at the table, I learn from you, you all tell us as tech folks what you need, then we can help design it. But I think us trying to answer things on our own, it's just not going to get there. We're not going to see things from your perspective. So I think the value in having experts in that area, in the medical educators, the physicians, to actually tell us what's needed, I think that's going to be key.
So you're actually giving a great recommendation to the United States of America. Let's work together.
Let's work together.
Let's make things better. If we all work together and we all bring the perspectives to the table,
Yes, sir.
We bring people to resilience.
Absolutely.
Daisy?
I really agree with this. I think we should try, because technology and everything's changing so fast. I really think, everybody, the expert, we should all come together and to really create something that really works. And then I remember there's a venture capitalist firm executive said what a kind of startups they wanted to invest in. They were looking for someone who is really serious about dedicating their life to this business ideas. So I hope we can have more business people who wanted to help everybody and to really wanted to make it happen. Yeah, to change people's lives.
I think so, and I also think bringing business people into it becomes very important, because once you get out of the protective cocoon of medical education, the world out there is business, whether you're in the public sector or private sector. So it becomes important. Thank you. Karin?
I'm just thinking about all the different intersection points here. And I think that as long as we remember that it's our duty to our patients that is, primary, doing the best job that we possibly can, I think that we can figure out a way to integrate this also into medical curriculum. There's an awful lot that students need to learn. And I think that, finding ways to integrate across everything that they have to learn is going to be really important, and not sort of siloing this as a special topic.
Right.
This is something that we have to figure out how to integrate into medical education.
Excellent. Excellent.
I couldn't agree with you more. Now you understand why the Y chromosome is not needed. Because with the X chromosome, not only do you get the brightest people in the world, they have the answers.
Right.
It's my honor to have met you in person. Please say hi to Vic when you return home.
Thank you so much.
And Jamie, thank you. Karin, thank you. And I'll see you guys for the rest of my career.
Yeah.
And Daisy, we expect you back, at least in Zoom calls.
Oh,
okay.
Thank you so much.
We're going to ask for your commitment to help us to educate the best physicians ever.
Always happy to.
Well, from Studio A in Las Vegas, the long summer break is over, and you have 3 incredibly intellectual individuals, but with the right heart, the heart to make the world better. So with that, till the next episode, goodbye from Cuba Pete.
They call me Cuba Pete. I'm the king of the rumba beat. When I play the maracas, I go chick, chiggy, boom, chick, chiggy, boom.